Hello, and welcome to the Natural PCOS podcast, the podcast dedicated to empowering women with polycystic ovarian syndrome through natural approaches. I'm your host, Dr. Samina Mitha, a naturopathic doctor with a passion for women's health and hormones. Each episode, I'll explore the latest insights and my personal experience to help you manage your PCOS naturally. Together, we'll dive into practical tips, inspiring stories, and the latest research to support your journey towards balance and wellness. Let's get started on your path to thriving with PCOS naturally. Hello, everyone, and welcome back to the Natural PCOS podcast. I'm your host, Dr. Samina Mitha, and today we're talking about one of the more emotionally challenging symptoms of PCOS, hair loss. Whether it's thinning at the crown or receding hairline or noticing more hair on that brush, especially, before you get in that shower or after the shower, we're going to unpack the common causes, how to assess hair loss, patterns, and what you can do naturally to support hair regrowth. I know losing hair can be really distressing. You feel like you're going to get bald, and I think one of the most important things is really advocating for yourself, pushing to get some lab work done, identifying what's truly going on the inside of your body, and then treating. So let's get started. Why hair loss happens in PCOS in the first place. One of the biggest issues, or I should say causes, is this hormonal connection between testosterone and PCOS. That elevated androgen, especially testosterone and DHT, dihydrotestosterone, this more potent testosterone, can really shrink hair follicles, cause inflammation in that hair follicle, and then result in that follicle entering into telogen phase. This is the last stage in the hair cycle. Basically, when that hair follicle enters into telogen phase, it's basically programmed for death. Within 2 to 4 months, it's going to fall out. So really important to figure out if it's related to testosterone and where the testosterone is coming from. Insulin resistance can really impact testosterone levels. So if you go one step back, where and why is the testosterone high in your body? Figure out if you have insulin resistance by doing lab work. And if the insulin resistance is present, that's where you really want to start. We want to also look at other factors like low iron, especially ferritin on lab work. This is our storage form of iron. We want this number to be really robust, a really good number to stay in growth phase in the hair cycle. And also thyroid dysfunction. We know hypothyroidism and Hashimoto's thyroiditis can cause the hair to become brittle and break. And so it's really important to assess for hypothyroidism, especially because we know women with PCOS have an increased risk of hypothyroidism. Chronic stress and cortisol imbalances. Stress makes a huge impact on the overall body, and this can also impact the hair. If you've noticed that your hair is falling out now, you want to look back 2 to 4 months ago to see, was there anything stressful going on in your life that could have caused some of these follicles to enter into telogen phase, and then kind of assess, okay, yeah, maybe it was stress, and this is something that may turn around by really working on the stress piece. Then nutritional deficiencies. What does zinc look like in your body? Vitamin D, how much protein are you getting in? This is really important to assess and make sure that you are actually getting the nutrients you need to support hair regrowth and also prevent hair from falling out. Let's go through some questions that I ask when assessing for hair loss. So these are some of the questions. Are you losing more than 100 strands a day? So what I actually get the patient to do is actually count how many strands they're losing per day and see, is this more than 100? Because hair does fall out naturally. And sometimes we feel like it's falling out more than it actually is. But then when we go to count it, it's actually a pretty decent amount of hair loss. And it's not something that we need to be concerned about. But more often than not, a lot of my patients with PCOS are saying they're losing more than 100 strands a day. Now, the second question is the hair coming out of the follicle? Are you seeing that little bulb attached to the very end of the hair? That means it's probably coming out of the follicle, and there's inflammation in that follicle, usually related to testosterone, and that's why the hair is falling out. Or is the hair breaking? So if you see shorter strands of hair, if your hair is really long and you're seeing shorter strands, it could mean that your hair is brittle and it's breaking, and this is more related to your thyroid. Has your ponytail gotten thinner? A lot of times what testosterone does is actually cause miniaturization of the hair, which basically means that the thickness of the hair comes down. And when that happens, patients will find that their braid is thinner, their ponytail is thinner, and that is a sign that it could be related more to testosterone. So what I encourage you to do is start keeping track of this, journal it, take photos every week to track the changes so you can really identify what the potential root cause could be. Let's go over different patterns of hair loss and what they mean. So if you're noticing hair falling out of this frontal hairline, your hairline is thinning or receding, it's often due to low levels of iron or low ferritin. So it's really important to check your levels of iron and make sure that if you're getting enough protein or take an iron supplement. If you find that your hair is thinning across the scalp or in this crown area or in the temples, it could be related more towards testosterone or DHT, dihydrotestosterone, which is very common in PCOS. If the hair is breaking, we want to look at thyroid. We want to look at protein intake and even taking a look at how many times you're washing your hair. If the hair loss is patchy, if you see like one little round spot circle, this is often due to autoimmune condition, alopecia areata. So really focusing on ruling that out and talking to a healthcare professional about that. So how do we assess with testing? We want to look for ferritin, your iron, your hemoglobin. You want to look at your full thyroid panel, TSH, free T3, free T4, anti-TPO, and anti-TG. We want to look at a full testosterone panel, total testosterone, free testosterone, androstenedione, DHEAS, and DHT, dihydrotestosterone. We want to look at vitamin D status, B12, and potentially even zinc. Zinc is a little bit difficult to test in the blood, especially if it's just serum zinc. Another marker that's a little bit more accurate is RBC zinc. These tests can really identify what's going on internally before you get invested in all these topical and supplemental treatments, because really hair loss is a direct sign that something is going on in your body that's deeper than just what you're looking at, and we need to figure out what that is. Let's talk a little bit about naturopathic treatments for hair loss. So first and foremost, that testosterone. We want to bring that testosterone down. There's herbal products that can really help with this. Saw palmetto, spearmint tea can help reduce testosterone, reishi mushroom, licorice, white peony, even green tea. So really supporting the body and actually reducing the testosterone that way. If we know it's coming from insulin resistance, we want to use things like inositol, berberine, dietary changes, right? Making sure you're getting enough protein and picking the carbs that are right for your body and also the amounts based on your blood work. We want to try to address stress and cortisol, giving adaptogens. These really help to balance cortisol throughout the day, especially ashwagandha is a very well common known one. There's so many more. And if there's anxiety, we're going to choose anti-anxiety herbs like passion flower, valerian root, catnip, lavender, California poppy. These all can really help with anxiety. When it comes to iron, we want to maybe choose a really well-absorbed iron like heme iron, iron bisglycinate, maybe pairing it with vitamin C to help with absorption, taking it on an empty stomach. We want to support thyroid health, making sure we're considering zinc and selenium and making sure we're getting enough protein and iron levels are actually really well intact, because low levels of iron can really impact the thyroid. So that's internal. Now topical, what we can really use are things like rosemary, because it can help reduce inflammation in that hair follicle. Another thing that has actually been studied that I saw recently was pumpkin seed oil. It was actually compared to minoxidil. This is a commonly prescribed medication for hair loss, especially from what I've seen in my women with PCOS. And it actually found that hair was able to regrow with pumpkin seed oil. Now it was topical, but also one of my patients recently took pumpkin seed capsule, and she found that actually really helped the hair in terms of regrowth, seeing some of those baby hairs and reducing the hair from falling out. Scalp massage is really helpful, buying one of those spiky scalp massagers and using it, especially in the areas where you find that there is some inflammation, maybe some dandruff. I've started using one of those and I feel like it's really helpful. It also helps to just increase blood flow to the area. A clarifying shampoo can be really helpful to remove buildup, really clean the scalp, and using this once a week could help. Brushing your hair before showering is extremely important because it actually reduces the breakage when your hair is wet, and avoiding like these really tight hairstyles or heat when you're styling your hair as much as you can. I know obviously you can't really not do that ever, but I think sometimes is okay. It's just if you're finding that your hair is falling a lot, you might want to reconsider that. Let's talk about timeline. So just to give you an idea, hair cycle takes a long time. It takes about 6 to 12 months to actually notice significant changes once you've actually identified and addressed the root cause. So give your body time to actually figure out and reverse some of these symptoms, especially with hair loss. What I really encourage patients is to be consistent and be very, very, very patient. Consider the smallest wins, like less hair shedding, less hair on the floor, less hair on my clothes, more like little baby hairs popping up that I hadn't seen before. You'll notice this. And when you see it, track how many hairs are actually falling out, because that will also help you. Because sometimes like it can feel like your hair's always falling out, but even just a drop in hair fall by 20 to 30% is actually incredibly helpful, especially because it takes such a long time to actually get that hair pattern and hair growth back in the cycle back to balance. Hair loss is extremely scary. I know when I was going through hair loss in postpartum, it was extremely scary for me. And there have been times in my PCOS journey where I've noticed more hair on the floor, and I've really worked to figure out what this cause could be in my case. And really the biggest thing is balancing blood sugar and stress, and also reducing sugar in the diet has really helped me. Stress is such a big part of PCOS, and managing this can really help. So journaling, meditation, yoga, walking, really helpful in supporting the cortisol and the DHEAS that we see coming from the adrenal glands. You're not alone with this. Your hair can improve. Trust me, if you really support your body, you can turn this around. It does take time, but it can work. I've had patients come back and, even just changing their diet, making sure they're eating less sugar, balancing the insulin, just that alone, right, is a big, big win for the body. And they've noticed their hair falling out less just because of that. So if we go back to what's the, takeaway of all of this, really identify the pattern of your hair loss, test your blood, and then treat from the inside out, and then support with some of these topical treatments that can help. Check out my website, saminamitha.com, for more resources and materials on PCOS, and share this podcast episode with anyone you know experiencing hair loss and who has PCOS. And your hair is a direct reflection of your internal health. And when you really begin to balance your hormones, your insulin, your cortisol, your glucose, and nourish your body from the inside out, your hair will actually follow. Stay tuned for my next episode, and I'll see you then. Bye, everyone. Thank you for tuning in to the Natural PCOS podcast. I hope you found today's episode insightful and empowering. Remember, managing PCOS is a journey, and you're not alone. For resources, tips, and to connect with our community, visit my website at saminamitha.com. You can also find me on Instagram at dr.saminamitha.nd. If you enjoyed this episode, please subscribe, rate, and leave a review. Your feedback helps me to reach more women seeking support for PCOS. Until next time, take care and stay well.